bit earlier on in your presentation, but we know there are primary care physicians shifting increasingly to working in hospitals. How is that, if it does, affecting, how is this consolidation affecting federally qualified health centers like Crossroads?
Yeah, that's interesting. I mean, I think community health centers are just affected by this primary care physician shortage. And so, if more family physicians and primary care docs, when they graduate, work in hospitals, it just means we need more primary care physicians, right? So in general, internists tend to specialize more, tend to work in the hospital, whereas family physicians tend to be more trained for outpatient. Doesn't mean you can't work in the hospital. There's certainly family docs that are hospitalists, but there's definitely a need for the outpatient family physicians at this point. So it definitely affects us. The last statistic I heard regarding community health centers and family docs is that 95% of health centers currently have an opening for a family physician, and that opening is on average out there, like they have that opening open for 18 months. So it's a huge need.
Thank you.
Adam, do you have a question?
Yeah, I was wondering, you touched on this towards the end of your presentation about telehealth. So even after the pandemic, like after a vaccine comes out, do you think telehealth will still play as big as a role as it is now, or is it gonna die down a little?
I think that it will continue to play a role. I'm not sure it will be at that 50% mark like you see there. We're sitting around 25% as our goal. Certain things you just can't do by telehealth, like a well child visit or pre-op or things like that. You have to have people come in. But what changed a lot was the federal reimbursement. So what Medicare and Medicaid reimburse for, usually the insurance companies kind of follow suit. So what happened back in March was that the CMS, the Centers for Medicaid and Medicare, said, okay, we're going to now reimburse for telehealth visits. It used to be that it was really hard to get reimbursement for a video visit. There were all these rules. And then they said, okay, we're going to just reimburse for it like the usual way. And so because of that, as long as those reimbursement rules stay the same, I don't see it going anywhere. And my understanding is that, and things are shifting quite a bit, but they have made those kind of emergency authorizations permanent. So as long as a patient's seen in the office once a year, you can see them by telehealth the rest of the year and bill for their visits. So that's going to be huge. I think, especially for vulnerable populations, for like the working poor, I think it makes a big difference because a lot of patients, they can't get in to see you. I've had folks that, they do a video visit from the break room at Outback because they're a cook at Outback, or they're working at the Amazon warehouse, or wherever they are, they go on break and they have their visit with me. And so it really, or they don't have transportation, so they do it from home. So it's a huge, I think it's a huge benefit for our vulnerable populations.
All right.
So if anybody's interested in shadowing or kind of seeing how our primary care docs work at Crossroad, feel free to email me and we'll get you hooked up.
Okay, do we have any more questions? Last call. I know we're a little bit over, but okay, well, in that case, Dr. Ade, thank you so much for speaking to us today. I know I learned a lot about primary care that I did not know, and I hope everyone also took something from your presentation.
Thank you, guys. Enjoy your day.
Thank you so much. All right. Just to conclude, I know it's been a while, but we want you guys to go out there and enjoy the afternoon. We hope that each and every one of you took, one key thing that you could apply to your own life, to your own career path. And we will be sending out some resources about each of the speakers, including Crossroad VIP program, that their current application is out now, but also just some resources to go along with each speaker. And if you missed any part of the event, it will be on GlobeMed's YouTube. We will also send that out in the email following. But other than that, we want to thank every one of you guys for joining us today, and we hope that you have a great day.
Thank you, everyone, especially Dr. O'Day. Enjoy the weather.
Thank you all for coming. Bye-bye.